All right. Hello, everyone. This is Kelsey Rettke, editor of the Daily Chronicle. I'm here with my colleague, Eddie.
I'm Eddie Carifio, sports editor and general assignment reporter for the Chronicle.
And we are here with a couple of folks from our local health department, DeKalb County Health Department. Lisa and Greg, if you want to just introduce yourself, please.
Good afternoon. My name is Lisa Gonzalez. I'm the public health administrator here at DeKalb County Health Department.
I'm Greg Maurice. I am the Director of Health Protection here at the DeKalb County Health Department.
Awesome. So I just want to start off, you guys, just by thanking you for being here. I know, again, everyone's time is precious, especially these days, especially our public health officials. So we really do appreciate your time, and hopefully we can walk through some of these things. So obviously, as we all know, Region 1 is in some mitigation efforts that were imposed by the governor and the Illinois Department of Public Health based on our case resurgences in DeKalb County and in the region as a whole, which includes like Rockford and Sauk Valley area, Winnebago County. So as a result of that, as we all know, there are a couple of things that have changed in the last month related to, prohibiting indoor dining at bars and restaurants, limiting large gatherings. So I'd like to sort of walk us through a little of both, the sort of enforcement side of things as it relates to the mitigations, and then also talk through some contact tracing stuff as well. So, maybe sort of we could start off, question for Lisa. I think we all need to be reminded, right, that there are human beings behind all of this stuff. Everyone sort of has a job to do in this scenario. Can you just walk us through, how many staff do you guys have at the health department? How many contact tracers do you actually have? Who's doing the checks on the restaurants? All that kind of stuff. How many people are you working with these days, Lisa?
Sure. So in general terms, let's say before COVID-19 hit and before there was funding tied to COVID, we had a staff of about 40 people. So 40 staff, and really those very beginning parts of the pandemic, let's say March, April, May, even June, we were essentially all hands on deck. So the work that we were doing early on, whether it be contact tracing, whether it be collecting PPE and distributing it, whether it be assisting the restaurants with questions they had at that time, we were using existing staff. So we sort of transitioned everybody at that time, all hands on deck to help with the initial early part of the response. We still are using many of our own staff, our staff previous to COVID, to do a lot of the COVID work, so don't get me wrong. But with the COVID dollars that came down, we have been able to hire some additional staff. So Greg has been able to add a couple people to his team, doing the working with the restaurants and looking at logistics for the response. We've hired a health educator to help us with that public health education piece, and then a lot on our contact tracing side. So for contact tracing specifically, we've hired 10 full-time positions. We are hiring as we speak. So literally we are hiring week by week as quickly as we can get people onboarded. We're doing that because this resurgence of the cases has really pushed us to our limits as far as contact tracing goes. And so we have an overall overarching goal with that funding to try to reach people within 24 hours. I'll tell you that with the number of cases that are coming in recently, it's really, really, really challenging to do that. So we have been able to build capacity, but the important thing is that we continue to build our capacity by hiring additional people, and we're still using existing staff for various functions of the response at this time.
And does that include, I know some health departments have like case investigators. Is that just a different title, or do you guys have that too?
Correct. So when I said the 10, it's case investigation.
Okay, great.
It's case investigation and contact. Maybe it's best, Kelsey, if it's okay, I'll just go back and kind of talk about what that looks like from the time the test is done. That way it sort of explains the difference between those two terms.
That would be perfect.
So, as individuals get tested in the community, they're tested at various locations. They're tested locally, they're tested at statewide sites, they're tested at pop-up sites, so on and so forth. Once that person is tested, right now it's probably within 24 to 48 hours, they get a test result. So Kelsey, if you're tested within 48 hours, you'd likely know what your result was. There is a little bit longer of a lag before we actually get the result through our system, which initiates contact tracing and case investigation. So once we receive that positive test through the statewide lab reporting system, we then begin our work reaching out to that positive case. We do a thorough case investigation, which takes about 50 minutes per person. And then at that time, throughout that interview, we're also determining who are their close contacts. And it is also our responsibility to follow up and contact all of the contacts of the case. So we love it. Go ahead.
I'm sorry.
You can stop me there. Go ahead.
I was going to say, what kind of questions are the case investigators asking? So, like, if I have tested positive, I get a call. Are you the one that is telling me that I have tested positive, or is that coming from the state?
Well, usually whoever took the test, whoever did the swab, is the one you first hear from.
Okay, so the lab calls me and tells me that I've tested positive. They probably, presumably, right, tell me to quarantine. And then, am I awaiting a phone call from the health department then?
That's exactly right,
okay.
Kelsey. So it could be your provider. If your provider put an order in for the test, it could be the testing site, like a physician's immediate care, for example, or it could be, directly from IDPH if they're doing the test. So there is a period of time where if you test, you should know you should stay home and stay away from others, because you're testing for a reason usually, and that means that you should quarantine until you hear from either your provider and then ultimately us, so that we can confirm everything with you. So you ask the kind of questions. Well, it's everything you would suspect we would ask. So we're asking things like, what were their symptoms, if any? When were they first symptomatic, so that we know when to start our count? We're asking them who those close contacts were. We're asking them, where have you frequented in the past period of time, so that we can find out if others may have been exposed. We still use that cumulative 15 within 6 feet for a cumulative 15 minutes in a 24-hour period. That's still sort of the metric we use for close contact. So we're asking a lot of that, gathering a lot of information. And then when we ask the close contacts, we're gathering the contact information, maybe the source of the contact, and then also the contact information for the contact, so we can reach them as well.
So it's sort of this ever-growing web of people that, like,
absolutely,
you keep calling 10 people after you talk to this one person.
Right. And so, in cases where it's a positive case in a congregate setting, you can imagine we have to act very quickly, because they have already potentially exposed others because of where they live, essentially, and trying to act very quickly to make sure we're doing what we need to on that side as well, isolating the patient or the person, depending on what kind of congregate setting they're in. So I mentioned that. I mentioned that, like, one case investigation takes about, on average, 50 minutes at this point. But you have
15
to then—
15 or 50, sorry.
50.
Okay.
And then each close contact who we have to contact takes additional time. So it is a process. So when you look at, let's say, 140 cases over a weekend, if you multiply that out, you can imagine the sort of influx that we're seeing right now.
I guess the dollar question is, what if somebody is not honest with you about where they've been?
That's happening. It's happening more and more, I think. And we can only take information we get. What we find, though, is that if the positive or if the positive or the contact to the positive is not honest, we can only take what information we're provided. However, sometimes through contact investigation, we find out additional information that maybe wasn't disclosed at first. So that's why it's called investigation, because we're doing a lot of fact finding and sort of reading through the lines and so forth in a lot of what we do.
I was just curious because you said that the people you initially contact are kind of expecting it. They tested positive, so they're kind of expecting that. But I was wondering now, when you contact the contacts of the positive person, is that like they're not expecting it necessarily? Do you get more blowback? Or are those kind of a different type of conversation because they're getting this call out of the blue all of a sudden?
Absolutely, Eddie. That's a great question. So yes, usually the positives are expecting that we're going to contact them. They're sort of waiting for our call, right? But the contacts to that positive may or may not know that they've been exposed, and we don't necessarily disclose who they've been exposed to. And so we do see more pushback as it relates to our contact with the contacts, because first of all, they're usually not happy we're going to quarantine them for 14 days. And they maybe aren't expecting the call because maybe the person who's positive hadn't shared that with them. And so we do have to make sure we work with our staff to sort of look at ways in which we can communicate with those who maybe aren't so happy to hear from us. But we are, you know, they're going through continuous training to make sure we're doing the best that we can in that area.
And are you guys doing, I know that when we spoke sort of at the start of all of this, Lisa, we talked about the difference between positive and presumed positive. So presumed positive was, you know, if Eddie has the coronavirus and I was at work with him, and then, you know, I am a close contact, but I haven't gotten tested. Are you telling these close contacts then that they should be tested now, or are we still doing the presumed positive where we're just saying you don't need to be tested, but you should quarantine?
Yeah, I mean, if they're asymptomatic, then they should not test right away. Like if I'm exposed to you today, it would do me no good to go get tested today. So what the guidelines say is between day 5 and 7 from last known exposure, you may want to get a test, right? Now, if that contact is already symptomatic, then yes, we would recommend they can get a test.
And you know, as we sort of go into the I know we've seen a lot of sort of pop-up drive-through testing sites. There's one in Sycamore today. There's going to be one in Genoa later in the week. There was one in DeKalb at the high school. I believe, are they asking anyone who goes through that line, are they asking them any questions, or is it just like a, you know, quick test, that's their job, and then you guys handle the rest of it?
They are testing everyone. So that means that you can go there if you are symptomatic, you can go there if you think you've been exposed, or you could go there just because you're curious. You want to know, you think, you know, you just want to be sure that you're not positive at the time. And they're accepting everyone because there is so much of that asymptomatic infection happening right now. And so I think at this point, they're not going into a whole lot of detail. Educating people though, coming through the line, like I said earlier in our call, that, to make sure that you are quarantining after you test, because it doesn't do us much good if you're going to go test and then run to every store in town, or, you know, go and see a group of friends when you may in fact test positive. So we're trying to make sure we're driving home that message as well.
And
so,
yeah, oh, I'm sorry, Lisa, go ahead.
No, go ahead. It's all right.
I was going to say too, when people are tested, so they should quarantine after they get tested to await results. If they test negative at that point, are they free to go about the world as they would, or what would your suggestion be?
It really depends, Kelsey. It's case by case, because if you are a close contact to somebody who's positive, you'd have to quarantine regardless of your test result. So we say over and over again, you cannot test your way out of quarantine. So if public health has told you you have to quarantine for 14 days, it doesn't matter if you get a test on day 7 and you test negative, we would still require you to stay throughout that 14 days in quarantine.
And the idea behind that too, right, is to mitigate the behavior too. So if you're testing negative, but then you want to go have like a large party, that's still ill-advised. Correct?
Well, I think the justification behind that is that you could pop up positive anytime in that 14 days. So once you've been exposed, it could be day 13 and you could develop symptoms, or you could be asymptomatic and be shedding the virus. And so I think that's the rationale between the 14 days more than the behaviors, I think. So I think I've explained sort of how the process works, but I'd like to, if it's okay, I'd like to sort of talk about like our capacity. We talked about the numbers of people hired, but sort of where we are right now.
Yeah, please do.
I mentioned that we are actively hiring contact tracing staff, case investigators, and contact tracers, same thing. And that we're hiring them as we go. The contact tracing grant's allowing us to do that.
And how much was that grant for you guys?
We had we were awarded $2.8 million.
Okay.
But a portion of that's not all directly for staff funding. There's obviously other things built in there. So at the beginning of the pandemic, our case investigation and contact tracing were primarily done via paper. So we've been doing case investigation for a very long time in public health, everything from chlamydia and gonorrhea to tuberculosis, you name it, any communicable disease we've been investigating. So we had an already established paper system of doing that. And then so the existing staff that were doing that work, they had used that paper system. And then in July, as we were just beginning to onboard people, the state rolled out the Salesforce system, which helps us to more automate that process. As new people have been coming on board, we have been training them in Salesforce, and they have been doing, so right now we're currently doing this combination of paper and Salesforce. But we're planning, because the grant will require us to transition to fully using the Salesforce system for contact tracing and in-case investigation.
And is this like a digital platform that you're talking about?
That's correct. It's
Okay.
a digital, they call it a contact tracing platform. And once we get everybody using it regularly and frequently, we think that it will give us really good data coming out of it. Right now, it's not very good because we're still doing this hybrid model of case investigation and contact tracing. So they rolled out the system in July. New people who are coming on board, they're being trained to use it and beginning to use it. But once again, we have this hybrid system of doing case investigation and contact tracing at this time. For that reason, you know, when we look at very initial reports that we're starting to see, they started to release some like last week. Our numbers don't look so hot coming out of the system because not everybody is using it. And so it doesn't accurately reflect what we're doing. So for example, we know that staff have worked really hard, in fact, 7 days a week to do contact tracing, to contact every single positive case that comes into our system. But because we've had all available decks on hand and we've been using this hybrid model, the reports coming out of the system, they don't reflect that at all. In fact, our numbers don't look that hot because, quite frankly, we're using this hybrid system. But I'm hoping that in a few months, when we look at that system, when we fully get everybody on board and trained, that we'll be able to pull out all the data that you guys are asking for, and be able to really show this is what we're doing and this is what it means and this is the trends that we're seeing. We're not quite there yet. That's just the reality.
Does the old data, I'm sorry, just to clarify that, will the old data that was being done by hand, will that eventually get imported into the system and caught up, or is that just always going to remain not in, I guess, the new platform?
Because it's actually a combination of being tracked in two different systems. So I can tell you that a portion of it will, Eddie, but probably not 100% of it.
Mm.
So I just want to make sure, Lisa, that I'm understanding correctly. So please correct me if I'm wrong. So it sounds like with this digital platform, is that like data that's still being inputted by like a real person, right? So like if somebody is interviewing a person who's tested positive, and then they probably input stuff in the database that collects that information and sort of aggregates it based on like, you know, would that be the one that would have that data that would show, you know, X number of cases might be connected to this type of industry, yes. X number would be in this industry. Am I understanding that correctly?
That's correctly. So,
okay.
Correct. Sorry. Ideally,
no, you're fine.
Ideally, yes. So
sure.
Ideally, we get a positive case. It actually shows up in the Salesforce system, that digital platform, and then we hit go. The case is assigned to a case investigator, and then they make the call. They data enter as they're having that call. The call is logged because they call through the system, and then you actually link the contacts to that case to the contact. And so we should be able to run reports about like, where have you been and what are you doing? And the state has more access to that data than we do right now. Right now, we're just really looking at really high level data. And once again, it's not very, the specific data that we see we're not seeing it be very accurate quite yet, because we're still getting people transitioned into the system. Does that make sense?
It does. It does. That's perfect. And I think that's a good transition to our next topic, which is enforcement. And, you know, for the contact tracing side of things, and we've talked a little about this before, but obviously, especially in the last couple of weeks, like last week especially, you know, the health department has started publicizing, you know, names of businesses that they are finding to be verifiably not in compliance with the indoor dining ban. And then, you know, we hear from our readers and otherwise, whether it's online, whether it's from, you know, elected officials who are frustrated, all of these people. So, you know, the concern is, does the data support the mitigations, right? And you're saying that it does, but we don't have that data collected in a conducive way yet. Is that accurate? Okay.
So I'd like to, if it's okay, I'd like to sort of talk about why restaurants and bars, or what is the rationale behind that? I think that's the first step. And then, you know, Greg can talk more specifically about the enforcement piece of it. So when we went to the state, when mitigations were about to happen at the very beginning of this month, we also were asking, you know, tell us the data that supports this. And you've heard the state health director and the governor talk about this on their press briefings as well. But essentially what they're looking at is some national data that one example is an MMWR report dated July 2020 reported that adults who are confirmed positive for COVID-19 were approximately twice as likely to have reported dining in a restaurant than those who test negative. So that's one of the national studies. There's others as well. That's just one that I could easily find. And then statewide, because I said they have more access than what we do to other data in Salesforce. They're saying that according to IDPH, regional data, doesn't matter the region, when they look at the top locations that positive cases have frequented, those are, in no order, workplaces, schools, restaurant and bars, and other gatherings. And so with schools and workplaces, contact tracing is pretty easy because we know where the students are, we know their desk assignment. In workplaces, we know who's working when, right? And who's working where, usually. And so it's pretty easy to contact trace. When it comes to restaurants and bars, it's just more complicated, especially with bars because people are typically standing up, they're close to one another, they're passing by one another, so on and so forth. And so that's the rationale that we've been given from the state level as far as why restaurants and bars. Locally, what I can tell you is that, and you've heard me say this, I kind of sound like a broken record, but the community spread is very widespread. Where at the beginning we saw cases primarily DeKalb and Sycamore where there's most population, right? But in the last month or so, it really is across the county in every zip code. You've seen our zip code data like totally change in the last month because community spread is real and it's widespread. When cases can be traced back to a common source, you've heard me say this before too, they can be traced back to other gatherings like organized sports, like weddings, like parties. And we're also finding so many asymptomatic positives. There's so many. And so that's what makes this so difficult is because there's so many people who are walking around right now without symptoms.
Do you think that, I know, like you said these things, I know a lot of this you brought up in that meeting a couple of weeks ago that the, whatever the hell was online that the commission did. But I was wondering, is it easier, do you think it'll become easier to get these points across when you have more local data? Like you said, when this program gets up and running in a couple months, you actually have hard numbers to be able to say, do you think that that will make it easier to get this point across? And that's maybe where some of this pushback's coming from?
Yes, but yes, Eddie, I think that's probably the case. Obviously, with more data, you have more to present and you have more justification for your decision making. However, the state's data is still data. It may not be 100% comprehensive, but it is a sample of who they're looking at. And so I would assume that our data would likely look very similar. So I think there's a lot to be told though from when we are able to pull more reports from the system. Once again, it is the expectation under the grant that every single health department use this Salesforce system at 100%. We're working towards that, we're getting there. And I think that it will be able to provide more robust reports and I'm hoping will help us in our charge. I'm just hoping it's not too late.
And with the, you know, you mentioned that you sound like a broken record, Lisa. I think we all sort of are feeling that too. You know, this is month 7. We have all of this messaging that, you know, you guys have certainly been saying for 7 months. The governor and IDPH director say the same about, you know, the risks of walking in the world not knowing that you have coronavirus and the number of asymptomatic people that we're seeing currently. You know, we know that it's an election year. We know there are, you know, people that are going to feel that things are political regardless of anything that's happening. But, you know, like, I think that we are seeing sort of the pandemic becoming this political, you know, divisive fueled rhetoric situation. I mean, what do you guys do with that as a health department? How do you like push back against that?
I mean, I think Greg would attest. We definitely know that a lot of this is political. It's politicized. But what I would say to that is that if you were to tell me that after the election next week, all of this would go away and get better, God, I hope so. But I don't think that's the case. I think we will continue to see an uptick in cases. I don't think we've seen the worst of it. I think with the holidays approaching, it's only probably going to get worse. And so, yes, we're dealing with the politics of this every single day. However, if you go back to the core public health concerns here, they're not going to go away. Our work is still, we have a lot still to do. So yeah, I think I'll pass it over to Greg if it's okay. If you want to hit, do you want me to summarize the enforcement?
Yeah, and I know, Greg, I mean, you sent me like 114 emails roughly on the enforcement process. So I was just wondering, like I was wondering what that actually looks like in practice, like when it starts getting along. Let's say, you know, we're even using an example, you don't have to use a real place. Let's say I'm a restaurant owner and I hate or whatever. My place is called Eddie's and I'm the owner. So what would that look like as we get further and further down the line, going from when you get that first call of someone to complain that, or, you know, the first that I'm not following the health guidelines?
Sure. So yeah, we can use Eddie's as an example. And basically, you know, I know you've seen the process and, you know, the written verbiage per se that's on there for procedures. But yeah, kind of just talking through that process. I mean, essentially, when we first get that phone call, email, online report, essentially coming in to us regarding an establishment, you know, we're seeing that complaint. So again, we are working, I guess, on a complaint type basis. Quite frankly, we wouldn't have the staff to begin to just drive around and, you know, try to just find violations. And that's not what we're about. I mean, we're there to help educate the establishments, you know, just the best guidance that's out there and, you know, try to keep everyone safe. So we are working, you know, complaint wise basis. You know, if something blatantly shows up in front of our face, we can't ignore it, but we are complaint based. So taking your example of, you know, getting that information sent to us, then we start off with a phone call to the establishment, basically telling them we received a complaint. This is, so in your case, you know, it would say, okay, on Eddie, we received a complaint yesterday telling us that there were 15 people inside of your restaurant eating. You know, this is the current stage that we're at with the mitigation. This is the steps, you know, currently there's no indoor dining allowed. You know, please just, if you're not aware, this is what you need to be following. So we would basically leave it at that. Now we have had a few places where instead of the phone call, we've had to send an email or a letter. It's still the same kind of verbal information though, even though it's going out in that format. Basically because we're having some establishments just not answering the phone for us now. When we're calling and trying to relay this information, you know, they see the health department calling and they're like, yeah, we're not going to answer that. Or for whatever reason, you know, that might be going on there. Once we progress on and get then a second complaint, further complaints coming in on this after that, after we've had that discussion, then we start basically with a written educational letter out to the establishments. So in this case, say 3 days later, we get another call that there's still people dining inside. We would then send that kind of written letter out to you. Again, follow up with a call, that letter, just say, hey, we're receiving more complaints. Please follow the guidance here on this and come into compliance. If that's it, it stops right there. That's, you know, that's perfect. You know, we don't want to proceed any farther. Again, if we can continue to get complaints in, if when we're doing our rechecks, essentially, you know, on that establishment, we would move on to the third step, which is a written notice of non-compliance. basically a little more legalese, I guess, in there to say that you've been notified, at least twice now that you're not following the current guidance. Here is, just saying that you are in non-compliance of that, and we'll give you X amount of days to come into compliance.
Now, you said recheck, that you guys, there may be a complaint or maybe recheck. Do you guys at that point, are you doing some, like actually going to and checking up the place between step 2 and 3?
Absolutely. So yes, between that step 2 and 3, I left that out. Thank you for reminding me on step 2. We're not only getting those other complaints, but we're verifying that it's a valid complaint. So a couple different ways we've been doing that verification. One is, an on-site inspection. There's times we can see the violation from kind of pulling in the parking lot and seeing 15 people inside dining. So that can be part of that.
And obviously you're not calling ahead, I imagine, right? To let them know you're going to do an outside visit. Okay.
Correct. Yeah. And once that starts, once we're kind of doing that validity of it, we are just showing up unannounced to see what's happening.
So just to check, so Eddie's, you get that first call, like you said on Eddie's, you call me, you tell me, I'm like, oh, sure, I'm sorry, it was an accident. Then nothing else happens. If you don't get another complaint, there's no checkups. If you do get another complaint about Eddie's, then you're going to do another call. You're going to tell you that, no, that's the written letter at that point, right?
Correct.
Then you're going to get a written letter that's informative. And then after that letter, you're also going to check up on me at some point to make sure that I am now following the rules.
Right. Correct. And even with that letter, before it's going out, we are checking the validity of that. So we're doing a drive-by, a stop-in at there, or the other option, which we've come up with kind of as something to help everyone out, is we're having a complaint form that's out on our website and just an online submittal that basically they're checking the boxes that they are, 2 things, one being truthful and honest with submitting the complaint, and that another box there that we really can use then for enforcement wise is that essentially they're willing to testify in court that this is what they saw at that time. So that once they check that box, we will count that as a valid, survey of that establishment. Now we're still going out there, but it's just more, enforcement that we can use. We've got more documentation there for that enforcement. And then once, like I said, it's basically how we're progressing through each step. So once you've got that written notice of noncompliance, on that letter, we're giving you, say, like 4 days out or whatever it may be, X amount of days to come into compliance and to start following the guidelines. We do a recheck on it at that point. If you're in compliance, again, it stops there. Now, we may get further complaints on in the future. And if we do, we'll keep progressing if need to, but otherwise it would stop at that point. After that recheck of non-compliance, so we go into Eddie's on that 4th or 5th day, whatever it might be that we're saying we're going to check this on or after. We would go in there. We still see diners inside. We're still getting complaints coming in. At that point, that's then when we would document what we're seeing, come back and essentially write up another, in this case, then the order to disperse / suspension, basically stating, that the health department is pulling that food licensure from that, which is food, beverage, anything that they'd be serving, and giving them time to comply, to work with us, so they can then reopen.
And then this is the step that, the one you just mentioned, this is now like step 4. And
Correct.
Only, is it still, if I remember correctly, one business in the county that has made it to this one? Only one has made it this far?
That was previous, Eddie. So that was in like the masking, like only masking and social distancing When we were in step 3, I believe that one was even back in, correct me if I'm wrong there, Lisa, was that step 3 or was that, would have been in?
I think that would have been in step 4, Greg.
It would have been in step.
When they opened for indoor dining.
Yes. So on that case, yes, that one was kind of previous before the mitigation measures went into effect. So,
okay, so there's been
that was in
more.
July. Oh, go ahead, Eddie. I'm sorry.
Oh, no, just what Kelsey said, pretty much what I was going to say, that was the one from July. And then, so you're saying there's been more reaching this point over the last couple of weeks? Because I've been trying to keep up on the website.
Right. So no, currently at that, we do have a couple we're waiting kind of in that time frame to do.
But no, not to this point, nobody else has reached that point yet, correct?
That's correct.
Okay.
Correct. Correct.
Okay.
That is correct.
And then when you're pulling those, when you're doing that fourth, so in step 4, when you're doing that site visit, when you're ordering, people inside that are dining to leave, when you're pulling the food permit, are you telling the business owner that you're pulling the food permit? What does that communication piece look like?
Yes. So yes, we would go in, we would still see that happening. We would then provide the owner, manager, whoever would be there, basically telling them that they need to have the customers leave, that we are progressing with the information and pulling their food permit. Now, physically, I know this was a question, I think, or a comment you got back from the one establishment there in July where they said, like, you didn't physically pull. We're not physically taking the permit with us. I mean, that's something we can do, but we're basically saying just disperse. Let's work with you. Let's get this back open, because we don't want anyone to have to be shut down. So, and that's exactly what happened in that July case where, we basically just had to, okay, close your doors for a few hours. Let's work on this. Let's get it back open. And then that 5th step would basically be once they're refusing to comply with that and keeping their doors closed, would be then going into filing with the state's attorney to go into court to then basically have a judge issue an injunction that would say this place must, remain closed for X period of time.
How would you say the communication in terms of relaying this information? Because this is obviously a very specific, very obviously process. So what's been like the communication like with businesses? Like, do you get the impression that businesses know, okay, well, we're in step 1 right now, we got to do this, or okay, this is a step 2 thing? Do you feel that they're following along with it?
I do. I mean, I know they are. I guess, yes. I mean, they are definitely keeping track of what step they're at. Because I know we will have places say, okay, just, I mean, like confirming in a comment, like, okay, so we are at step 2 now, or we are at step 3. So yes, they are tracking along with what level of enforcement they're at.
Go ahead, Eddie.
No, you go, Kelsey.
I was going to say, what sort of spurred the decision for you guys to want to start doing that public list? I know, I'm sure you guys have gotten some flack for that. We certainly have in terms of our coverage. Obviously, there's this, again, sort of, rhetoric and this sort of divisive us versus them. We need to support local business, which of course everyone wants to do. And we also need to address this pandemic. What would you say spurred that decision? Do you think it's going to help things? What are you seeing in relation to the business community now as we sort of enter into this next week and the week after and the week after?
Greg, I'll go ahead and start on that one, and
okay.
Then you can pipe in as well. So we did go back and forth for some time trying to decide how best to manage through this period of mitigation. And we hadn't posted it publicly until, as you know, very recently. So we were really talking back and forth, really Greg and I, regarding the amount of public interest. So we are a government entity, therefore we are subject to FOIA, and we began to get quite a few FOIAs about, who are you enforcing and what are you doing? And so part of it was that we wanted to be as transparent as possible, because the administrative burden of a lot of requests for that specific information. But I think more importantly, the spreadsheet that we use to track our enforcement is a live document. And so it literally changes by the hour. And so to be able to put that out there in a way that would be as transparent as we can be, but at the same time, so that people wouldn't have to try to figure things out or interpret themselves, that's why we decided to do it. So we know that Winnebago County did it before us. We didn't do it because of them. In fact, I think Winnebago and DeKalb right now are the only ones in Region 1 doing it. But it was mainly just to try to improve transparency. We tried to be really careful about what we were posting and how we were posting it, making sure that we verified the complaint before we just posted it out there publicly. It's not meant to be punitive, though. It really is just to try to streamline information, to try to reduce the administrative burden, because so many people were interested in the information. So that's, there's no hidden agenda really, except for that. Greg, anything else?
Yeah, no, I mean, I 100% agree with that. I mean, that, like I said, we're not trying to be punitive. I know some people may think that it looks punitive being out there, but you know, we're getting a large volume of requests for information, and people interested in this, whether you're on, I'll say, one side or the other. You know, some people want to know the list because that's where they're going to go dine. I mean, we're getting comments like that back
yeah,
to us
we are
too.
too.
You know, but
Yeah.
I mean, we're just trying to be transparent with what's out there, and we haven't posted that first step, which is like I said, we get a complaint, we make that phone call, because you know we are not going out and verifying that very first step. We're just treating it strictly as an educational, you know, hey, we had this complaint, please, this is the information, follow it up. And that's why we haven't listed that information, that we're not listing it on our website. I should say. Now, you did see that though in the FOIA that you got.
Oh, sure, yeah. Yeah.
That would have that first step 1 listed on it. So that you might see a discrepancy there, just to explain why.
And because our enforcement is complaint driven, we know that our list, even the published list, is probably not 100% comprehensive, right? It's only who we've got complaints on. But having said that, if you look at what we posted Friday, we'll update this Friday. We had 14 establishments on there. There could fall under this mitigation. And there are a lot choosing to comply, right? They're choosing to do, even though it's really hard, even though it's affecting their livelihood, even though they're having to maybe have staffing impacts, they're choosing to do the right thing. And so I think we could flip it and say that yes, 14 are not complying. We verified that, but there's a lot more that are. So I think it's important that we put that out there as well.
Mm-hmm.
I think that's a really good point, Lisa, and you know that's sort of what the balance is with our own coverage too. You know, we did receive that full list too, Greg, and we didn't post all the businesses on there, because you're right, there is that education component, and you know I think that is important, and I think it's especially important too, because I think, you know, a lot of people are thinking, oh my God, we are in these terrible times, and we sure are, but there are also people that are following the rules and are complying too. On that note, have you guys received any updates on the Banquet Center conundrum? So I know that we talked a little last week in regards to not just verandas, but just sort of this sort of high-level general, how do we interpret the mitigations, right? And it seems like there's perhaps a gray area in that space. Have you received any more direction from the state on that, or no?
We have not. We are still waiting on that clarification from the state.
Okay. Well, I guess one last question, and I do appreciate your guys' time, unless Eddie has anything else that he'd like to add. Certainly, you totally can do that, Eddie. you know, I guess my question, and I'm sure everyone wants to know, right, including you guys too, is where do we go from here? I mean, we're seeing surges, not just in DeKalb County, not just in our region, not just in our state, but in the whole country, numbers that are worse than they were in the spring and the summer. I think we're seeing more public pushback from whether or not it existed before, certainly more public pushback on mitigations, on enforcement, on shutdowns. People are tired of this. You know, everyone sort of is coming at this from different angles. You know, where do we go from here? How do you guys sort of see us in the next week or so? I mean, how worried are you about this?
I don't know. Kelsey, you had asked when you sent the request, you know, what are some messages, and without, I guess, risking sounding like a broken record, I talked a little bit about earlier in our call today that we really want people to understand that if you think you could have been in contact or you're having symptoms or you've been tested, quarantine, right? Quarantine yourself until you know for sure and you've gotten further instructions. I think that's critical. The 3 W's, you know, we've been preaching this from the very beginning. You know, wear your mask, wash your hands, making sure you're keeping distance. I know with the holidays coming up, it's going to be particularly hard to do that. People want to gather, they want to get with their friends and family. I get it, me too. However, we know that masking works. We have national data that says, if we look at outbreaks, for example, we can say, you know, this group was all wearing masks, they did it well, and it worked. They didn't spread the infection further. And so say what you will, but when it comes down to it, making sure that social distancing, masking, and washing hands is critical. Also, when you're thinking about getting together as a group outside of your household, you know, keep the group small, wear a mask, stay socially distanced, get together, but do that. If you do that, we're going to be much better off as a community. And then I think probably the last couple things I would say is if you hear misinformation, stop it, you know, because there is a whole lot of misinformation out there that I think part of it's political, but part of it is just misinformation. And so if you know the right answer, then share it. Without being confrontational, I think people can do that, and it'd be super helpful if they could. And then lastly, we can still support local businesses. It might look different, but we can still support them. You know, as I said before, there are over 400 establishments that are impacted by mitigation. We have a small portion maybe making decisions that are not in support of the mitigation strategy, but everyone can support local business by shopping locally, by ordering in from your favorite restaurant. As the holiday approaches, get that gift card from a restaurant that may be struggling. Really get out there and try to do our part there as well. As long as you wear your mask, you should be able to get out and do that. Greg, anything else you can think of?
No, I mean, that really, I think, sums up our message that we've been, as Lisa said, we've been saying is kind of as a broken record over several months that all of us have been putting out there. Is just really, it's very simple. I mean, some really simple ideas here to, you know, yes, I suppose it's not fashionable. It's not, you know, nobody wants to have to wear a mask out or not be with your extended family and friends, but just really try to keep it simple. We'll get through this.
This is definitely anticlimactic to all of that. But there was one thing with the reporting that I don't think you guys have spelled out, but I think it's kind of important. And it's one thing I've heard a couple of the restaurant owners that I've talked to say, or allude to false complaints being made against them and stuff like that. But that's kind of the point of the system, is it not? That why that first complaint is just basically a call and then nothing else, correct?
Absolutely. Yes, that's exactly right. And, you know, kind of as I mentioned in there too, you know, we're not out there making these complaints up. And man, I wish I had the time to, you know, just sit back and, hey, let's just write this complaint today. You know, nobody's doing that. And I mean, we are getting, you know, can I say that all of the complaints we got in have been 100% valid? No, but that's why we have these steps, and that's why we are checking the validity of these ourselves on there, and the staff is checking these to make sure that they are valid, and getting the information. I mean, you've got, like I said, people with the submittal now that we've kind of the form we've changed too of saying I'm willing to testify that this is the information. They're checking that. They could be penalized in court for falsifying that information too. So that's why we have this system set up and the steps.
Yeah.
Okay, that was what I had.
Well, thank you so much for your time, you two. I really appreciate it. Like I said, I know you guys are busy, and we wish you the best of luck as we continue in this process. And we just hope that everyone continues to stay safe and healthy.
Thank you very much, Kelsey, for the opportunity.
Thank you.
Yeah. Take care, you guys. Thank you.
Thank you.
You too.